Hello and welcome to Sister Zandi RSA. So for this video session, we will be speaking about or going into the next step of the patient's pathway in accessing healthcare services within the primary healthcare level. So we've done our preparation. I think I might have forgotten to add with the preparation, if there was any requests or requirements from your previous visit, either to be fasting because they're going to be taking labs on you or blood samples from you. That's also something you need to always remember and keep in mind. Or if you're required to take a certain medication within a certain time, so that when they assess or evaluate any of your vital signs or your bloods, they are able to get the information that they are seeking based on the healthcare education communicated to you by the healthcare provider you last saw. So now you are prepared and ready to get to the healthcare facility, and you arrive. Upon arrival, long queue. Everybody knows this, long queue, and it can be daunting even for the healthcare specialist or provider, because it is a very here we go again moment, which is why you need to mentally prepare. It never ends. That queue is long. And you try to sit and wonder to yourself, how do I make it through these days? And how do I make it that I actually try to attend to as many patients as we allow in the facility? Because in some facilities, there's actually a limit, depending on which form of consultation that you will be receiving. There's actually a limit to how many patients that they can see. And by the time that the patients have arrived at the clinic, they've been given numbers according to which area or department they're going to be visiting in the clinic. And it's sometimes color-coded, but yes, there is a number. And some sections don't have a number or a limit. They are just open right through from 8 a.m. to 4 p.m. And the patient flow just goes on, and it's open. So the patient arrives at the healthcare facility. Remember, you have your card that has your information that is linked to your medical file, or you have your ID. First place you're going to go is either straight to a reception area where they're going to be retrieving your medical record file. But some institutions actually plan and create interventions to meet patients halfway, where they can actually drop it off in a stack so that it is issued within an order, or the files are prepared or put into the room that they are going to follow up in. It is all different kinds of systems that is dependent on the healthcare facility. And for some they feel like it works, for some it feels like it doesn't work. But unfortunately, guys, within the resources that we currently have, everybody is trying their best to be the most efficient, the most effective, and to try to bring patient safety and satisfaction all at once, irrespective of the compromise due to resources, either being human resources or actual equipment or medications, or diagnostic equipment that they might need. So please, as patients, be patient. Please, and remember the different channels that you can actually take, which I have shared also on previous videos, on what initiatives you can engage in to help promote, help change, help influence, help enhance your experience when you are accessing healthcare services. So please do explore those channels. As community members, as staff members, we need to get organized. You need to be well numbered for you to present your concern and be able to follow up as well, so that it is attended to and an effective strategy is applied and put into place. I'm going to tell you something. When you're organized and you work in numbers, you will be able to conquer a lot. And I've always known this, just known it, but I watched this other movie. It's called Dumb Money. You should search it. You'll understand what I'm saying. But anyways, back to what I was talking about. So you've arrived at the clinic, you have handed in your either clinic card or you are there with the ID and it's your first time opening a file / folder, and you are creating a medical record number. Thereafter, you will be assisted and redirected towards the area in which you're going to be attended to. So not everybody walking into the clinic is going to be getting to the same room. Not everyone. The clinics have tried to organize themselves and applied strategies, some strategies even influenced by community members feeling like they are being exposed, their diagnoses like HIV or TB is being exposed because everybody knows if they are going into a certain room or waiting in a certain area. So certain interventions and strategies have been applied, and with those measures being put in place, they are able to separate to say, okay, we can attend to our chronically ill patients, like patients with hypertension and diabetes in this area, for those coming for wound care follow-up in this area, for those coming for mental health care follow-up in this area. Literally, I promise you that the strategies that have been put in place, that have been presented due to the concerns and complaints of the community, and the interventions that have been inspired by the healthcare specialists as well. So when you do get there, after that, your folders are sorted, you will be redirected into the different rooms that you're going to be going to. In some facilities, they prefer that they actually put you through the assessment room where your vital signs are checked, your blood pressure, your sugar levels, your temperature, weight and height if necessary, where they are checked before you can actually go to the room or join the queue within the room that you're going to be consulted in. So once the vital signs are done, when you're there, by the way, part of your preparation, try to wear clothing that is easy for you to either roll up a sleeve, or if you want to take out a sleeve, so that you don't find yourself undressing. You know, sometimes it's a bit uncomfortable to undress yourself in front of somebody you don't know. So you don't find yourself having to strip and undress yourself just to be getting a correct blood pressure reading. Try to wear clothing that enable healthcare specialists to be able to carry out any investigations based on your either presented complaint or even if it's a follow-up. Most people already know this. Those that are regulars at the clinics, they already know this. So for those who don't know, this is just an emphasis. Right, so you will either go there, you get your vital signs checked. If they are within normal ranges and they the nursing or healthcare practitioner that has taken these vital signs feel that they are stable, they will then redirect you to the respective room that you'll be going to for either your consultation or your follow-up or further investigations, labs, eye tests, so forth, as per prescription, remember. But if they feel that it is not normal and you need immediate attention, they will definitely redirect you elsewhere. So please do not feel demotivated or get too anxious. I know that we always try to expect the unknown most times, but we need to keep optimistic. We need to be engaged. We need to be aware. Ask questions. Ask why are they sending you to a different area instead of the area that you came here for. Don't allow to just be pushed to the side, pushed to that side without you understanding what and why is happening around you, you know. So if they feel like your vital signs are stable, they will continue to redirect you to the respective room you're going to go to. If they feel like they need urgent attention, they will redirect you to their respective area. Either they have an ER, either they have a particular CNP, clinical nurse practitioner, or even a medical practitioner that can see you since it needs emergency attention. So once that part is done and you will join a queue, unfortunately sometimes, most times, you will join the queue and you will wait your turn to be attended to. So sometimes you're sitting out there and it feels like you're waiting for a long time. But we need to know and we need to always understand and respect the fact that every person is there for their own reasons, and sometimes when they enter into a consultation room or they are being seen or attended to by a healthcare specialist or medical provider, it will be different for each and every person. Some people need longer times because they need more assessments. done or examinations done in correlation with their presenting complaints or any findings that is based on their follow-up. So don't despair. Don't get too agitated. Don't get angry. I know sometimes people get angry and you just see, Shane, the nurse just went to the bathroom. The next thing, somebody's like talking behind their back. Look at them. They are doing this, they're doing this. Please stick to your business. Stick to what you came for. Stick to what you came for and be patient. You will get your chance, and be ready to present yourself to the medical practitioner or to the clinical nurse practitioner or the respective specialist that you're going to see. Be prepared. Focus on what you came for. Be prepared and be able to share as much information as you can to help with the assessment and the planning of the examinations and the diagnosis as well. It is very important to give sound information. Don't change it to try to sound like you're doing well and healthy, because it doesn't reflect the honest feedback that is needed for your medical practitioner or your healthcare specialist or your clinical nurse practitioner or whoever is going to be attending to you to be able to assist you effectively. You know, imagine you were last seen and you were given a chronic medication for, let's say, diabetes, and you experience side effects like maybe nausea, vomiting, dizziness, and polyuria, all kinds of weird, okay, not weird, expected, known, but you are experiencing these side effects and you don't communicate them. Instead, you're like, no, I'm fine, the medication is all right. Then they wouldn't know that they actually need to try a different medication with you. They wouldn't know that if it is being effective or not effective. You know, communicate when they open your file that they checked my sugar, but this is what I had to eat in the morning before I had my sugar checked, and it was at this time. It's about how many hours since the last time I had a meal. This is why it's low, this is why it's high, so that they can understand if the interventions that have been prescribed for you before are actually working, and if not, that can come with new interventions that they can apply to help you with your diagnosis. For some people, it is not like chronic medication, but rather follow-ups with blood tests. For some people, it's follow-ups like on a wound. Maybe you had been exposed to a severe burn and you had a referral to just get your wound checked up. You need to communicate any abnormalities, you know, things that you were told to look out for. If there was excess oozing or exudate from your wound, if the ointment that is being prescribed is making you or giving you some form of discomfort, if the equipment that was supplied to you was not enough, you didn't have enough bandages, so you skipped certain days whereas you were supposed to clean and wash it off. You need to communicate all of those things, and you need to be able to be honest and not be embarrassed. I know sometimes it's very hard to communicate when you're having your own personal social issues that affect the way the intervention had been prescribed or communicated to you with regards to your health education. So maybe you couldn't have the access of doing the cleaning every day and applying the bandage every day. Either there's nobody at home to help you, or you just did not understand the communication given to you. You need to be transparent and honest about it, so that important information is relayed, and then adequate feedback is also given back, so that you are able to now apply or even get more resources or assistance from the healthcare specialist, from their healthcare education and advice. So it is very important that when you are having your opportunity of consultation, that you are transparent as best as possible. I know most of the times we find ourselves working in clinics within the community that we live in, and it gets hard for you to exchange and share details that you feel are quite personal to you. But remember, for as long as it's affecting what you came to the clinic for, it is important for you to communicate it with your healthcare provider. So thereafter, there'll be an assessment done based on the information you shared, and there's going to be a look at the history based on the last time you were there. If it is your first time that you've been there, a history will be taken and jotted down. Don't bother reading. Sometimes the writing is just off the charts. The reading or the handwriting is off the charts. You're not able to just make out what is written there. Takes you some time. Even us as healthcare practitioners amongst each other, you're like, okay, now I get it. So please don't bother trying to read. And please, today, early morning, I was exposed to something that happened on social media where they were sharing how people actually manipulate information that is written in their files. I just want to advise you guys, it is illegal. It is illegal. Do not do that. Do not write information if you are not licensed as a healthcare practitioner. Do not manipulate information on your folder thinking that it's going to help escalate or help you get attended to faster. Do not do that. It is illegal. You will get arrested for it. You will get arrested for it. Don't even try it. If you know somebody that wants to do it, just stop them. Don't do it. And it can further cause harm to you. And in this instance, it was actually a maternal case, or I could say antenatal visit, where they were just saying, no, I just changed my blood pressures and I make them a bit higher. That's already a diagnosis on its own. Please don't do that. Don't do that. Don't do that. It will lead to complications. You will find yourself getting drugs that you did not need, and it can lead to severe complications. Do not do it. You're not licensed to do it. You're not qualified or competent to do it. Don't do it. Don't manipulate or alter information on your medical records. Please don't do that. Anyway, going forward, after the assessment has been done, sometimes examinations will be carried, sometimes examinations won't be carried, depending on the purpose or reason that you are having the consultation. Upon having examinations carried, please do ask why it is being done, so that when you leave the clinic, you don't sit and wonder, why was I being palpated on my abdomen? Why was the medical practitioner or the healthcare practitioner pressing on my abdomen? What were they looking for? Ask. It is your responsibility to also know what is being done to you. Thereafter, your consultation and discussion that you have had with your clinical nursing practitioner or a healthcare specialist, then you can have a discussion like, what is their findings? Don't let them just close the file, hand you the file, you're going to the next section. No, have a conversation. Ask them what is their findings. Ask them what do they advise is best for you to try to do, that you could do outside medical or pharmaceutical intervention, either from medications or follow-ups, what it is you can do on your own at home to help you recover, to help you be better or get better. So have those open conversations. Ask about the medication that is being prescribed, if you're familiar with it. As I said, if you know the medication that you have taken before, you know the name and the doses and the strength and the frequency, you need to communicate that I have taken this medication before. It does not work well for me. I've had allergic reactions, or I've had severe side effects, or I have mild side effects. Can I get something that's going to help subside the side effects? This is your opportunity to have a conversation about the plan and interventions of your diagnosis before you leave the room, so that you don't sit on the benches having your own multidisciplinary team. You know how it works. Discussing amongst each other that, no, they wrote this down for me. No, but I also went for hypertension. Why did they write this down for me? No, don't do that. Focus on your specific diagnosis, your specific reason for being there, and take the opportunity of consultation for you to ask questions and probe so that you can get the answers that you need to know on how you can manage either the side effects, how you can go about optimizing your medical treatment, or if you know that the follow-up date given is a date that you'd be either out of town or you won't be available due to other commitments, Communicate so that you know if you should come earlier or you should come later. Will there be any specific arrangements made for you specially so that you are attended to, and your interventions or prescribed health education is not compromised due to anything. So thereafter, once you have the opportunity to be in a consulting room, whether it was for chronic illnesses, whether it was for follow-ups on your blood results, whether it's follow-up on your treatment for tuberculosis or HIV, whether it's a reproductive health follow-ups. Thereafter, if they are redirecting you to go to either the pharmacy, or they say go to a particular room to get a follow-up date, or go to a particular room for a further investigation, be it a scan or be it blood collections, then you will be leaving that room and going there. If you're going to be waiting at the pharmacy as well, please practice patience. As you can see, if you open your eyes, the people that are always working are always outnumbered by the people coming to receive these healthcare services. So as much as we are healthcare specialists and nurses, we are working within a multidisciplinary team, working with occupational therapists, we're working with physiotherapists, we're working with pharmacists, we're working with the doctors, and at any point it is always that the people or the patients will outnumber them. So as much as you would like things to go extremely fast, you'd also appreciate that somebody does their work well enough to give you good quality. I mean, imagine spending 4 hours at the clinic only to go home and you got the wrong medication and you got the wrong follow-up date, and you don't want those things happening. So don't be a driver of pressure on healthcare practitioners or healthcare specialists. Be patient. Work within the system that is provided at your particular facility. If you feel like you have any concerns or complaints you want to raise, or any strategies that would aid or improve things, please apply the interventions that I had advised in the previous videos and take the necessary steps for you to be able to get a successful either feedback or implementation of those strategies. So once you have gotten to your either secondary referral within the clinic and you have collected your medication, you will drop your folder or your file, medical record file. You will drop it off at the reception. They will file it accordingly. Please make sure you do have your card with you and it's not inside the file. Please make sure that you do know when is your follow-up dates and they are clear to you, and that would be the end of your primary healthcare pathway. Should it be that there has been any abnormalities, any emergency indicators from any assessment or findings, there will be a referral made for you, actually, for you to go to a secondary healthcare facility or a tertiary healthcare facility to get further healthcare treatment. So please let that not also discourage you. It is only for your benefit, in the sense that it's to benefit you to get the adequate or most appropriate level of healthcare service based on the findings made by the healthcare specialist that was attending to you. So if they say to you, we found certain things and we need you to go today, we need you to go to the district hospital, or I'm going to book a certain date for you, you need to go to a district hospital to get a CT scan done. Please follow accordingly. It is only for your health. And if you have any questions, do not hold back. Don't go home, make a rant on social media, because it is your responsibility to probe and ask questions when you're in the consulting rooms or when you're being attended to by a healthcare specialist. I know you guys would reach out to us privately. I've had this, I still have it. I think the last time somebody reached out was yesterday, actually, where they reach out and they are asking about what had happened in their visit. And I don't have much to say because I do not know much. I I don't have access to your history and record, and now I just need to deal with like subjective information, and it won't really help. So when you get that opportunity and you're having a consultation, probe, ask. And for my fellow colleagues as well, healthcare specialists as well, please share as much information in layman's terms for people to understand. Let the patients and the communities we serve understand why we are doing things with them, to them, for them. They need to understand why certain interventions are being done. They need to understand why they're being referred to certain places. It shouldn't be at a point where they first need to ask and probe. You should be giving comprehensive information to the patients and the community regarding the plans and interventions. This should be all inclusive to the health education that we give upon the minute that the person is now going to be exiting or leaving the room, or they are just moving to the next consultation room for further investigation. Give sound information, clear information. Ask them if they understand. If they do not understand, elaborate further. It is very important for everybody to be in full acknowledgement and understanding of what is going on within their experience of visit at the clinic. And I think we have covered it at this point. Thank you so much.